Have you ever wondered what's really going through your doctor's mind when you step into their office? It's not something we like to dwell on, but the truth is, behind those warm smiles and professional nods, some doctors hold unspoken assumptions about older patients that can quietly shape the care you receive. These hidden beliefs aren't always kind, and they're rarely discussed openly. Yet they can influence how your concerns are heard, how your treatment is designed, and even what options you're offered. In this video, we're diving into 5 eye-opening truths about what many doctors secretly think about older adults. Knowing these can empower you to demand the respect and care you deserve in every medical encounter. Stick with me until the end, because the final truth might just transform how you approach your next doctor's visit. Let's dive in. Number 1. They often assume your symptoms are just old age. One of the most frustrating realities for older adults is that some doctors are quick to dismiss symptoms as just part of aging. You walk in with joint pain, fatigue, or memory lapses, and instead of investigating, you might hear, "Well, that's normal for your age." While aging does bring changes, this assumption can lead to missed diagnoses and delayed treatments for conditions that are very real and very treatable. According to a 2021 study in the Journal of the American Geriatric Society, up to 30% of older adults with treatable conditions like hypothyroidism or anemia are initially misdiagnosed because symptoms are attributed to aging. That shortness of breath? It might be brushed off as slowing down when it could signal early heart disease. That forgetfulness? It might be dismissed as a senior moment when it could stem from a medication side effect or vitamin deficiency. This mindset isn't always intentional. Doctors face intense pressure to see dozens of patients daily, sometimes as many as 20 to 30 in a single shift, according to the American Medical Association. In that rush, it's tempting to lean on the simplest explanation: age. But simple isn't always right. Conditions like depression, early-stage cancers, or even sleep apnea can be overlooked, leaving you to struggle longer than necessary. I once met an 80-year-old woman named Margaret who complained of persistent fatigue. Her doctor told her to take it easy and chalked it up to her age. After months of frustration, she pushed for blood work, which revealed a treatable iron deficiency. Once addressed, she was back to her vibrant self, gardening and dancing with her grandkids. Her story shows why we can't let aging be a catch-all excuse. Your symptoms deserve a thorough investigation, no matter your age. A persistent cough, sudden weight loss, or mobility changes aren't just normal. They demand attention. Research from the National Institute on Aging shows that early intervention for conditions like heart disease or arthritis can improve quality of life by up to 40% in older adults. So, speak up. Ask questions, demand tests, and make it clear you want answers, not assumptions. Your health at 75 is just as worthy of care as it was at 35. Number 2. They may think older patients won't follow treatment plans. Here's another unspoken truth. Some doctors assume older patients are less likely to stick to treatment plans. This belief often stems from stereotypes about memory, hearing, or the ability to manage complex regimens. A doctor might think, if I prescribe multiple medications, they'll forget, or this therapy's too complicated for them. A 2020 study in gerontology and geriatric medicine found that 25% of physicians admitted to simplifying treatment plans for older patients based on these assumptions, even when patients were capable of more. This can lead to less thorough care. A doctor might skip a cutting-edge treatment for arthritis, assuming you won't manage the follow-ups, or avoid discussing lifestyle changes that could lower your blood pressure, thinking it's too much. But many older adults, yes, even in their 80s, are sharp, engaged, and eager to take charge of their health. The same study showed that 70% of patients over 65 adhered to treatment plans as well as or better than younger patients when given clear instructions. I know a man named James, 77, who was diagnosed with diabetes. His first doctor gave him a bare-bones plan, assuming he wouldn't follow a detailed regimen. But James was determined. He switched doctors, and his new physician laid out a comprehensive plan: diet, exercise, and medication. James followed it to the letter and now manages his condition so well he's back to hiking with his dog. The lesson? Show your doctor you're ready to take charge. Bring a notebook, ask for written instructions, and clarify anything confusing. By proving you're committed, you break down stereotypes and open the door to the best possible care. If you're finding this video helpful, drop number 2 in the comments to let me know you're with me. And if you haven't already, hit that subscribe button and turn on the bell so you don't miss our next video. Your support fuels more content like this. Number 3, they may prioritize younger patients. This one's tough to hear, but in high-pressure settings, some doctors unconsciously prioritize younger patients. It's not always intentional. It often comes from a belief that younger people have more years to gain from treatment. A 2022 report from Health Affairs found that in busy hospitals, older patients were 15% less likely to receive urgent diagnostic tests compared to younger patients with similar symptoms. This bias can mean fewer follow-ups, less aggressive treatments, or being passed over for procedures that could improve your life. For example, a doctor might hesitate to recommend surgery for an older patient, assuming recovery will be harder, without asking if you're willing to take it on. I spoke with a woman named Susan, 83, who was told knee surgery was too risky for her age. But Susan was active and determined to stay that way. A second opinion revealed she was a great candidate for surgery. After a successful procedure, she was back to her daily walks in months. Stories like hers show that age shouldn't dictate care. Your health and goals should. Don't let this bias sideline you. Share your priorities with your doctor, whether it's staying active or enjoying time with family. If you feel overlooked, seek a second opinion. Your life at 70, 80, or beyond deserves the same urgency as anyone else's. Number 4, they may undervalue your life goals. Some doctors assume that older patients only care about comfort, not chasing dreams or hobbies. This can lead to treatment plans that focus on getting by rather than helping you thrive. A 2019 study in The Lancet found that 40% of older patients felt their doctors didn't ask about their personal goals, like traveling or staying active. For instance, if you mention hip pain, a doctor might prescribe painkillers instead of exploring physical therapy or surgery that could get you back to golfing or dancing. I met a man named Henry, 79, who wanted to travel to see his newborn great-grandson. His doctor, assuming he just wanted to stay comfortable, offered minimal treatment for his chronic back pain. When Henry switched doctors and shared his travel goal, his new physician created a plan with physical therapy and medication adjustments. 6 months later, Henry made the trip and said it was a memory he'd cherish forever. Your goals, whether it's gardening, volunteering, or a big trip, matter. Tell your doctor what you want to achieve and ask how your care can support those dreams. If you're still here, comment number 4 below. And don't forget to subscribe and hit the bell for more videos like this. Number 5, they may overlook the emotional impact of aging. Physical health gets the spotlight, but emotional well-being is just as critical, especially as we age. Yet some doctors miss this. A 2023 study in JAMA found that only 20% of primary care visits for older adults included discussions about mental health, even though 1 in 4 seniors experiences depression or anxiety. Loneliness, grief, or fears about losing independence can affect sleep, appetite, and even recovery from illness, but these are often dismissed as just aging. I knew a woman named Clara, 81, whose health declined after losing her husband. Her doctor adjusted her meds, but never asked about her emotional state. When Clara finally saw a counselor, her mood and physical health improved dramatically. Don't be afraid to share your feelings. Stress, sadness, or loneliness aren't complaints. They're vital clues to your health. A good doctor will treat your mind and body as a whole, leading to better outcomes and a stronger sense of purpose. These truths might feel heavy, but they're not here to discourage you. They're here to empower you. Not all doctors think this way, but knowing these realities arms you with the confidence to advocate for yourself. Your health, wisdom, and dreams are just as valuable at 80 as they were at 30. Walk into your next appointment ready to ask questions, share your goals, and demand thorough care. If you feel dismissed, don't hesitate to seek a second opinion. The best care happens when you and your doctor are partners, working together to help you live not just longer, but better. Thank you for watching. Drop a comment with one thing you learned today and how you'll use it. Your thoughts inspire us. If you found this helpful, like, subscribe, and share. We'll see you in the next video.